guys, welcome back. Hope you guys watched our previous videos on routes of drug administration. Today's topic is pharmacokinetics. We divided this topic into 3 parts, so let's start with part 1. Pharmacokinetics. When we look into the word pharmacokinetics, there are 2 words, pharmaco and kinetics. Kinetics or kinesis. It is the movement or motion. Overall, pharmacokinetics means what the body does to the drug. Let's look into the definition. It is the quantitative study of the drug movement in, through and out of the body. This is the schematic depiction of pharmacokinetic process. When the drug is administered, it gets absorbed into the plasma and it may enter into the site of action or stored in the tissue or get metabolized and then excreted. Pharmacokinetic consideration therefore determine the routes of administration, dose, latency of onset, time of peak action, duration of action, frequency of administration of drug. Once the drug is administered, it is absorbed, that is, enters the blood, is distributed to different parts of the body, reaches the site of action, is metabolized and excreted. All pharmacokinetic processes involve transport of the drug across biological membranes. This is the illustration of organization of biological membrane. In this picture, we can see the polar groups which are oriented on the 2 surfaces and the non-polar hydrocarbons which are embedded within the matrix with extrinsic and intrinsic protein molecules. What is biological membrane? This is important 2-mark question. This is a bilayer of phospholipid and cholesterol molecules. The polar groups of which these are oriented at the 2 surfaces and the non-polar hydrocarbons are embedded in the matrix with adsorbed extrinsic and intrinsic protein molecules. How are drugs transported across the membrane? Passive diffusion and filtration and specialized transport. What is passive diffusion? When the drug diffuses across the membrane in the direction of the concentration gradient, as you can see in the picture, from higher concentration to the lower concentration. Hence, membrane playing no active role in this process. And this is the most important mechanism for majority of the drugs. Usually, lipid-soluble drugs diffuse by dissolving in the lipoidal matrix of the membrane. What are the factors affecting passive diffusion? 1. Lipid solubility. 2. Concentration of the drug. 3. Influence of pH. Lipid solubility. More the lipid soluble, faster the diffusion. Concentration of drug. Greater the difference in the concentration of drug on the 2 sides of the membrane, faster is its diffusion. Influence of pH. Most drugs are weak electrolytes, that is, their ionization is pH dependent. Weakly acidic drugs which form salt with cations, example sodium phenobarbital, sulfur diazyme, and weakly basic drugs which form salt with anions, example atropine sulfate, ephedrine HCl, chloroquine phosphate, etc. Filtration. It is the passage of drugs through aqueous pores in the membrane or through paracellular spaces. Usually, lipid-insoluble drugs cross biological membrane by filtration. Only if the molecular size is smaller than the diameter of the pores. Majority of the cells have very small pores of 4 angstrom, and drugs with molecular weight greater than 100 or 200 are not able to penetrate. So, they pass through the capillaries. However, capillaries have large pores of 40 angstrom and most drugs can filter through these. Diffusion of drugs across capillaries is dependent on rate of blood flow through them rather than only on lipid solubility of the drug or pH of the medium. Specialized transport. It is of 2 types, carrier-mediated and pinocytosis. What is carrier-mediated? When the drug combines with a carrier present on the membrane and this carrier translocates the drug from one phase of the membrane to the other. and this carrier transport is specific, saturable and competitively inhibited by analogues which utilize the same carrier. And this is of two types, active transport and facilitated diffusion. Active transport. It is against concentration gradient and needs energy and inhibited by metabolic poison. In this diagram we can see molecules moving from lower concentration to higher concentration, and this is active transport. Facilitated diffusion. This is more rapidly than simple diffusion, and this is along the concentration gradient and does not need energy. Usually occurs in renal tubules and hepatic sinusoids. In this diagram we can see the molecules are moving from higher concentration to the lower concentration, which depict facilitated diffusion. Pinocytosis. It is the process of transport across the cell in particular form by formation of vesicles. This is applicable to proteins and other big molecules and contributes little to transport of most drugs. Absorption. Absorption is defined as the passage of the drug from site of administration into the circulation. Drugs taken orally may be absorbed from any part of the gut. Acidic drugs are absorbed from the stomach while basic drugs from the intestine. Factors affecting rate and extent of absorption of a drug. This is very important and mark question. Let's see what are the factors. Disintegration and dissolution time, formulation, particle size, lipid solubility, pH and ionization, area and vascularity of the absorbing surface, gastrointestinal motility, presence of food, metabolism and diseases of the gut. Let's see in detail. Disintegration and dissolution of time. When drug taken orally, it should be broken up into individual particles to get absorbed. Usually liquids are absorbed faster than solids. When the drug is given subcutaneously or intramuscularly, the drug molecules has to be dissolved in the tissue fluids. Delayed in disintegration and dissolution, as with poorly water soluble drugs like aspirin, results in delayed absorption. Formulation. Pharmaceutical preparations are formulated to produce desired absorption. Inert substances used with drugs as diluents like starch and lactose may sometimes interfere with absorption. Particle size. Small particle size is important for better absorption of drugs. Drugs like corticosteroids, greaseprevir, digoxin, aspirin and tolbutamide are better absorbed when given in small particles. Lipid solubility. Lipid-soluble drugs are absorbed faster and better by dissolving in phospholipids of the cell membrane. pH and ionization. Ionized drugs are poorly absorbed while unionized drugs are lipid-soluble and are well absorbed. Most drugs have weak electrolytes and exist in both ionized and unionized forms. Example, aspirin and barbiturates. Strong acids and bases are highly ionized and therefore poorly absorbed. Example, heparin, streptomycin. Area and vascularity of the absorbing surface. The larger the area of absorbing surface and more the vascularity, better is the absorption. Thus, most drugs are absorbed from small intestines. Gastrointestinal motility. Gastric emptying time. If gastric emptying time is faster, the passage of the drug to the intestine is quicker and hence absorption is faster. Presence of food. Food delays gastric emptying, dilutes the drug and delays absorption. Drugs may form complexes with food constituents and such complexes are poorly absorbed. Example, tetracycline chelate calcium present in the food because of which their bioavailability is decreased. Example, ampicillin, roxithromycin and rifampicin are well absorbed only on empty stomach. Metabolism. Some drugs may be degraded in the GI tract. Example, nitroglycerin, insulin. Such drugs should be given in higher doses or by alternative routes. Last one, diseases of the gut like malabsorption and aclohydria result in reduced absorption of drugs. Bioavailability. It refers to the rate and extent of absorption of a drug from a dosage form as determined by its concentration time curve in the blood or by its excretion in urine. This is a plasma concentration time curve depicting bioavailability differences between three preparations of a drug containing the same amount. In this graph, we can see B is more slowly absorbed than A. C is absorbed to a lesser extent, hence it has very low bioavailability. Let's look into the definition. It is a measure of a fraction of administered dose of a drug that reaches the systemic circulation in unchanged form. Bioavailability of a drug injected IV is 100%. Bioavailability of a drug taken orally is frequently lower because the drug may be completely absorbed. The absorbed drug may undergo fast-pass metabolism in intestinal wall or liver or be excreted in bile. Incomplete bioavailability after SC or IM injection is less common but may occur due to local binding of the drug. What are the factors affecting bioavailability? All the 10 factors which influence the absorption of drug also alter the bioavailability. Let's recall them. 1. Disintegration and dissolution time, formulation, particle size, lipid solubility, pH and ionization, area and vascularity of absorbing surface, gastrointestinal motility, presence of food, metabolism, and diseases of the gut. Biological inequivalent. Oral formulation of drug from different manufacturers or different batches from the same manufacturer may have same amount of the drug but may not yield the same blood levels. This is biologically inequivalent. When the two preparations of a drug are considered bioequivalent, when the rate and extent of bioavailability of the drug from them is not significantly different under suitable test conditions. Tablets and capsules contain a number of other materials, diluents, stabilizing agents, binders, lubricants, etc. The nature of these as well as the details of the manufacture of process, example, force used in compressing the tablet may affect disintegration. The rate of dissolution is governed by the inherent solubility, particle size, crystal form, and other physical properties of the drug. Bioavailability variations assume practical significance of drugs with low safety margin or where dosage needs precise control. It may also be responsible for success or failure of any antimicrobial regimen. Please like, share and subscribe to our channel and help us to reach more. Thank you so much for watching. We will be back with part 2.